Hi everyone, this is Molly with Mom's Clean Air Force, and I'm here in Washington, D.C. today talking with Katie Huffling, who's Director of Programs for Alliance of Nurses for Healthy Environments. And I wanted to talk to Katie today about a new report that was released by the U.S. Global Change Research Group, which is a consortium of 13 U.S. government agencies and departments that just released a report about human health and climate change. Hi Katie, thanks for talking with us. I wanted to ask you first, what are nurses seeing already with climate change and human health impacts?
We're seeing a variety of different things. On warm days in the summer where we have high ozone levels, you're going to see more kids having asthma attacks and more people coming into the emergency room with respiratory or cardiac issues. I'm a nurse midwife, and some of the things that I was seeing in my practice as well on those hot summer days are more moms going into preterm labor because it's hard to stay hydrated on those hot summer days. We're also seeing more families being displaced from things such as extreme weather events like the storm that we just saw down in South Carolina this summer. So we're already seeing lots of different impacts here in the United States.
So here in the DC area, it's almost mosquito season. Can you talk a little bit about mosquitoes and climate change?
Sure. So what we're seeing with climate change is that mosquito-borne illnesses such as things like dengue fever, West Nile virus that many of you have probably heard on the news, we're seeing those spreading throughout areas that we hadn't seen them before because we aren't getting those die-offs in the mosquito populations like we used to. So this is of concern because it can be really challenging to prevent these mosquito bites and to prevent these mosquito-borne illnesses from spreading.
So at Mom's Clean Air Force, we're especially concerned about air quality. What do we know about climate change and air pollution?
So we know with climate change, we're going to be seeing a couple of different things. We're going to see higher levels of air pollution, such as particulate matter, which makes it harder to breathe and can have problems for people with different chronic illnesses, such as asthma and other respiratory issues. We also know that in areas such as the DC area, on those really hot summer days, we have higher levels of ozone. And when you breathe ozone in, it's almost like getting a sunburn on your lungs. And this can make it hard for even healthy people to be outside and be active like we want them to be.
So what do nurses need in order to effectively respond to climate change?
I think we need a few different things. One, nurses just need to be educated about the ways that climate change is impacting the health of their clients and communities. If we're a public health nurse, somebody that's working in the community, having resources to help our communities address these issues is really important as well.
Thanks for talking to us, Katie.
Thank you.